Hello and welcome to another episode of the FemiNinja Project, and thank you so much for tuning in. I really appreciate it. And I have such an amazing guest with me today. I'm so excited to have him here. His name is Dr. Doug Lucas, and he is a Stanford fellowship-trained orthopedic surgeon who was consistently saddened by the status of his patients because the healthcare system failed to provide the right guidance to prevent bone loss, which ultimately led to the need of his surgical services. He pursued an additional fellowship in anti-aging, metabolic, and functional medicine, and launched his own health optimization practice called Optimal Bone Health MD. He now educates and serves patients around the world that we are more than our bone density, that a natural, comprehensive approach to bone health can reverse osteoporosis in most people, and that no one should have to live in fear of fracture. Dr. Lucas, thank you so much for being here and welcome to the show.
Thank you so much for having me. I'm really happy to be here.
I absolutely love this topic. And when I saw your profile, I just knew I had to get you on the show. So tell us your story. Tell the audience how you became interested in the anti-aging, the bone health, just what the journey was like.
Yeah, I'll try to keep it short because I could describe this for a long time. But I was practicing as an orthopedic surgeon, like you said. So came out of fellowship training, went into practice, had a kind of a subspecialty practice. Foot and ankle was my fellowship that I did at Stanford. But I practiced general orthopedics as well. And for those that aren't familiar with that term, basically it's the guy that does everything. We took call, we fixed the fractures, the fragility fractures, the hip fractures, took care of the spine fractures and all of it. And that practice was going great, as I thought it would. But I was surprised by how my patients, even though surgery would do really well, the surgery was great, they would come out on the other end, not necessarily that much better. And this is a funny thing that happens in training, particularly in the surgery realm, is that we kind of go from service to service. So we'll spend, 6 weeks on the spine service, and then you'll do 6 weeks on another service, and you kind of just bounce, which is good because you can learn all the different subspecialties to some extent that way. But what's bad about that is that you don't really get long-term follow-up. So you would see other people, but you didn't really know the beginning point. So it didn't really jive with me until I saw them in my own patients a couple of years out, that even though a surgery could go really well and you could fix that particular problem, the big picture was usually not managed by the surgical procedure because that's not what we do. And at the same time, my wife, who runs a nutrition business, started helping people in the nutrition side of things, and she was really making an impact. She was reversing diabetes. People were letting go of all their blood pressure medications and really changing their life and energy and all this stuff. And so I started thinking, gosh, am I on the wrong end of this thing? Like, how did this happen? And so I just started recognizing that more and more people that I would see coming into my office, I recognized that, yeah, I could make them different. And maybe I could fix a specific problem if they had it. But overall, we were missing the big picture. And over the course of the first 3 years of practice, my wife's business started to grow. We realized that we needed ultimately to move from the area that we were in. We started practice in Durango, Colorado, so not too far. And so we settled on Asheville, which is where we are now. And when I moved, I switched to a private practice model. And I thought that would give me the flexibility to maybe change my practice a little bit, maybe start to think a little bit outside of the box. Turns out that it was actually worse because I had to take call at a busy trauma center. I was handling really sick patients, and it was so time consuming that I was really stuck in this little box. And so I had to make a really hard decision that coincided with the beginning of the pandemic as well, which is I have to leave this practice and do something else because I was just miserable, and I was miserable to be around. And so so just ask my wife. And so I did that, worked part-time for our local hospital system, and that's where I got my second fellowship in the anti-aging and metabolic medicine, and eventually went on to get the status of fellow and all that stuff. That training then continued to open my eyes. So I was able to say, look, there is another way to manage patients. There is an entirely different realm of medicine that physicians can practice in that's just scary to get into because it's so uncertain. So eventually made the decision to walk away completely and start my own practice. Overlapped them actually for a while because I started the practice but didn't really have any patients. But once I really committed to the practice and I started
Mhm.
hiring the right team, and I really had to just burn the bridges and step away from orthopedics altogether.
Mhm.
So once I did that, things really took off. And we started actually not in the bone health specialization space. You mentioned Optimal Bone Health, and that is a company that we run. We actually have another company called Optimal Human Health, and that's the company that we started. So we actually run these two parallel platforms. It's the same team, it's the same
Mhm.
approach. It's just shaped differently depending on what the patient's goals are. So our bone health patients, we steer towards optimal bone health. And there are several things that we do different there. And actually, there's a lot more value there because it's what we've built out more. We've really loved the space of bone health because the platform that we built is, as I mentioned, perfect for reversing osteoporosis for most
Mhm.
people. So now we have the YouTube channel. We have a book that is launching actually this week as we're recording. I'm not sure when this
Oh,
will come
wow.
out.
Congratulations.
Yeah, so that'll be out once this is out. And we're just loving the space because we're seeing such incredible change in our patients.
Mhm. I have to tell you, it must have been really, it took a lot of courage to be able to step out of that box and create your own space.
Mhm.
When you were doing that, did you have any like regrets or any pushback from any of your colleagues? Like, are you out of your mind type of thing?
Yes and yes. No, it was a long, hard journey because personally, I loved operating and I
Mhm.
trained for a long time to be able to do what I was doing.
Right.
Stepping away from that was challenging,
Mhm.
but I knew I was doing it for the right reasons.
Mhm.
And I did enough of the back and forth game where I didn't really commit to it, and I would sort of leave and then come back and leave and then come. And so I knew when I was there, when I would go back and I would say, okay, I'm just gonna like let's just do this surgery thing, and I was miserable again, you know.
Mhm.
So it was apparent to me, and I did a lot of question asking and guidance and prayer and all that stuff, and
Mhm.
I kept getting the same answer over and over and over again.
Mhm.
So finally, my hard head said, "Okay, just do
Mhm.
it."
Yeah,
But
sometimes
once
you
I
get
made the
that
commitment,
proverbial two by four over the head.
yeah, I mean, once I made the commitment, it's just
Right.
been on fire. So I really, yeah, it was tough for me, but it was tough for my family too. And my
Mhm.
wife, she didn't like the idea of me stepping away from a sizable, steady paycheck. Right?
Right.
That's a big deal. I put all the financial burden of our family on her shoulders for a period of time, and it was an
Mhm.
unknown period of time. So that
Mhm.
was really tough, and that hurt me too, just from a pride perspective and how I want to take care of my family. And
Mhm.
I put myself in a very challenging predicament. My peers, yeah, they mostly think I'm crazy.
Still?
They they get it. I mean, they understand it because they see
Mhm.
the need. But as far as leaving a practice, leaving that certainty, and also walking away from the surgical training, and some of them don't agree with that. How can you take
Mhm.
that, the hands that you've trained for how many thousands of hours, and the people that have trained you for how many thousands of hours,
Mhm.
and now you sit behind a computer screen and you help people through a telehealth practice? They don't like that. But I think overall they understand the purpose. And ultimately, if they know me and they're a friend of mine, then they can see how I'm a very different person in this space than I was in
Mhm.
that space.
And a much happier person.
Absolutely.
So when you were doing the surgeries, I'm just curious if you were doing trauma fractures, or were you also doing joint replacements?
I did some joint replacements. I did a lot of replacements in training, but once I was
Mhm.
in practice, they sort of petered out pretty quickly. I feel like joint replacement is something that really should be done by subspecialists, where that's
Mhm.
all they do.
Mhm. Now, my husband has had two knee replacements in 18 months, and I was shocked at the technique now. And when he came home the first day, he saw his surgeon, and he says, "Well, we're going to do it here, and then you're going to, take me home the same day." And I said, "Oh no, I'm not." And he says, "Oh yeah, they just," and I'm thinking, how am I going to take care of this guy? He's 6'4", and yeah, I'm a PT, but still. And yeah, he came home 5 hours after the surgery and he was perfectly functional. I couldn't believe it.
Yeah. Yeah, it's come a long way. And that's what I mean too about the surgery part. I really like, because you can really do a lot of good in surgery,
Mhm.
but particularly in my subspecialty in the foot and ankle space, the problems that led to needing the surgery those problems still existed after the surgery. So
Mm-hmm.
we can do a perfect surgery, and the outcome overall is better, kind
Mm-hmm.
of.
Yeah. So I'm really curious about your practice, and I loved your team. I did go to the website. You have a phenomenal team. And I'm curious how you were able to get a team like that together and how you work together with your
Yeah, and
patients.
actually, what you don't see is we have really been adding to our team. So we have 3 new coaches that are all starting, and they're not new coaches; they're new to us, and they're amazing. And my PA is on there, and we're probably going to add a second PA position here
Mhm.
soon, because the demand from the bone health side has just been tremendous. So the way that we acquire the team, it's almost like we just create the space and they almost come to us.
Mhm.
Um, we are in such a unique place. I mean, we are, we're integrative and we're functional, and you could use all these terms,
Mhm.
but it's rare to see it put together like we do. And so when people have experienced it or seen it through another provider or a family member or whatever, and they want to practice in that mode, they
Mhm.
reach out to us. So we do advertise for the positions, but usually we fill them before we even look.
Mhm. So what about your patients? What type of patient, like I'm thinking age group, are they mostly
Mhm.
female because they're more concerned about osteoporosis and bone loss? What type of patients do you deal with mostly?
So on the bone health side, I would say 2/3 of our patients are women, a surprising number of men actually, and this is where the statistics I think don't really tell the story on the male
Hmm.
side.
Hmm.
But for the most part, we're talking to women aged 45 to about 65.
Hmm.
Not that we can't help women older than that, because certainly
Hmm.
that's where osteoporosis becomes more prominent.
Hmm.
But where I really love to focus on is in the 45 to 65 group, there's so much more runway to make improvement.
Mm.
And the diagnosis seems to be so debilitating in that age group too, because it's early, and a lot of
Hmm.
times they got a diagnosis from like a surprising body composition DEXA or something. That wasn't what they were looking for, where they've had a fracture and then they get a diagnosis and they're so taken by surprise. And so working with that group is very profound, because we can make such tremendous changes.
Hmm.
Hormone replacement becomes a more viable option depending on the age and where they are in the menopause cycle.
Hmm.
Um, and we just have more tools, and they're willing to do more, and they have less comorbidity. So we kind of focus on that group. Now we have plenty of people in their 60s and 70s that we work with too. We just can't do as much, but we can still make improvements, and we can
Hmm.
certainly still improve the anxiety and the fear that goes along with the diagnosis.
Well, yeah, there is a lot of fear. I mean, just sit down and watch TV sometime and see all of the commercials. You're going to fall, you're going to die.
Yeah,
And
that's right.
it's almost like you don't have a choice. You are going to fall and you are going to die unless you take these medications to help build bone density. So, will you talk about some of those medications? Because
Yeah.
my understanding of it is that some of the side effects are pretty awful or can be.
They are pretty awful. Yeah. They're just downright scary. So I recently just finished going through and releasing videos on each one of the medication classes on YouTube. So I kind of have this like a 20-25 minute spiel on them. And the short answer for me on drugs is that they're overutilized. Like you just said, that 30-second, ad sort of sums up the approach in the traditional medical community. And this is
Mhm.
not a slight on that approach. This is
Mhm.
just what they're trying to do. But the risk of falling and having a fracture is very real. It's actually the number 4 cause of death for men and women over the age of 60, right? So it's
Mhm.
like, cancer, cardiovascular disease, stroke, and falls. I mean, that's it.
Mhm.
So we don't talk a lot about it though, because there isn't, in the traditional medical model, a lot you can do about it other than prescribe these drugs. And the failure rate from women and men not wanting to take these drugs is really high,
Mhm.
50% in some studies, up to 80%. People don't want to take them because of the side effects.
Mhm.
So the most common class used today are the bisphosphonate drugs. They're the drugs that you would hear like Fosamax, Reclast.
Mhm. Mhm.
Those drugs are designed to slow down bone loss, but the way that they do it is by poisoning the cells that do that side of bone metabolism. When you do that, you are really impacting in a negative way bone metabolism, and you're essentially halting bone loss, but also
Mhm.
bone growth. And so this is where you see the scary side effects. The one that scares most people is called osteonecrosis of the jaw, which is
Mhm.
as bad as it sounds.
Mhm.
And it can be extremely debilitating. It's terrible. And then there are other things like atypical femur fractures, which occur, and both of these things occur, not commonly. But if you give these drugs to enough people, people are going to start getting them. Also, the longer you take them, and this is
Mhm.
a big issue I have with this class, but actually all of the drugs, there is not a long-term plan from a drug
Mhm.
perspective. And this is where, again, I look at patients in their 50s and 60s and say, okay, well, I have a health span anti-aging practice, right? So
Mhm.
my outlook is decades.
Uh-huh.
Some of these drugs you can take for 1 year or 2 years or 3 years or 5 years. Prolia you can take for 10 years, quote unquote, safely. But if you're 50, that's still not long enough, right? So what are you going
Mhm.
to do when you're 60? And so there are ideas, and you can stack drugs, and you can do all this stuff. But ultimately, I would prefer to take a natural approach. Let's figure out why you're losing bone. Let's reverse those causes of bone loss, and then put you on the path to building bone. And then, and only then, if you are at such a dire starting point that a drug that helps build bone might be considered, then we would consider using a drug. But I can
Mhm.
tell you over the course of, I don't know how many hundreds of patients we treated, but over the course of that time, I think we've prescribed an anabolic like drug 3 times.
Wow. In how many years?
This is the third year. Um,
Wow.
So, I mean, so for us, obviously, it's rarely. Now, we have
Mhm.
a subset of patients who are coming to us because they don't want to take drugs. So,
Mhm.
there's obviously bias there. But so that's the one, that's the main group of drugs and the side effects associated with those. I could go through all of them, but I could probably talk for the next 20 minutes. So let me know how you want me to
No,
go
that's
down
okay.
the pathway.
What I would like you to focus on then, as an alternative, how you help your patients build better bones, build stronger
Yeah,
bones. So I'm
yeah.
guessing there's a lot of the nutrition aspect of it that's involved. And I'm wondering, does your wife still work with you? Are you a partnership
Yeah.
in the business?
No. So she has her own business. And I didn't mention it earlier, so I should mention it now. So her business is called PhD Weight Loss and Nutrition, and she focuses, as you might anticipate, on weight loss. And she's created a really great program. And if weight
Mhm.
loss is somebody's primary thing, I don't even work with them. I just say, look, just go work with her because she has got that figured out.
Mhm.
Um, yeah, helping people to lose weight, maintain weight loss, it's awesome. So in our space, though, most of my patients in the bone health side do not need to lose weight. Some,
Mhm.
but most not, which is
Mhm.
good because weight loss and bone and muscle growth do not go hand in hand. And so our approach is based off of two different frameworks. So the bone health framework we call the 4R method.
Mhm.
And we created this just to try to explain our thinking around how we like to handle osteoporosis.
Mhm.
And so I'll just walk you through the 4Rs. The first R is to recognize why we're losing bone. So
Mhm.
what is it? Like, we shouldn't accept that bone loss is a normal part of aging. Just like you shouldn't accept lots of things when you look at it from an anti-aging perspective, but
Mhm.
bone loss, I think, is one of those. So if you are losing bone, especially rapidly losing bone, boy, let's figure out why. And it usually comes down to what's happening from a hormone perspective, because this obviously happens around menopause. And then there is typically almost always a gut dysfunction component. So
Mhm.
those are two main things. And then we're also going to look at inflammation, thyroid, toxic exposure. And our blood panel is very extensive. And then we do functional testing if needed to identify that issue. Once we identify that issue, then we go to the second R, which is to reverse those causes of bone loss. And
Mhm.
this is where I have to be a little FTC careful to say that we're not always reversing osteoporosis, but honestly, we are, because
Mhm.
osteoporosis is diagnosed by imaging, and we are reversing T-scores. So there. But our goal is to reverse the causes of bone loss, and that's how we get around that and say that very clearly, because we can usually, for the most
Mhm.
part,
Mhm.
fix gut function. We can use hormone either replacement or optimization, depending on the scenario. And then we can figure out what the other things are that go along with that. And then we retest. That's the third R. And this is a big problem I see with a lot of patients, is that they'll just pick a plan and they'll just do it forever and never retest. You got to know if it's working. And so we retest to make sure we're headed in the right direction. And then the fourth R, which I love the most, which is to revive your life and live without the fear of fracture,
Mm.
because it is that fear and anxiety that I see most burden people with the diagnosis.
Well, and I think the fear and anxiety makes things even worse. It can accelerate the process because you're
Hopefully
trying to
worse.
be so overly cautious.
Yeah. Well, and so this is the problem I see. And if anybody listening or watching has had this happen to them, I'm so sorry, because this happens all the time. So you go to your doctor, they get a DEXA for whatever reason, and you're diagnosed with osteoporosis. And they say, you have osteoporosis. You need to take calcium, vitamin D, and lift more weights, but don't lift more than 3 pounds, and then walk out the door. Yeah, and they're like, well, wait, what? What am I supposed to do?
Mhm.
And then they go online and they get all this conflicting information, and it's just a disaster, right? They just don't know what to do. And again, there's something, the fear, anxiety, and unknown. And
Mhm.
that's why we really launched the YouTube channel too, was to just like, let's just look at this from a logical, objective
Mhm.
perspective. And I talk a lot about literature. I just basically present data, right? Like I
Mhm.
can't treat people through YouTube, but I can
Mhm.
present studies, I can present case situations, I can present situations, and it's been really well received.
In your program, do you have do you have like a physical therapist or someone who promotes resistant training, that type of healthy exercise to be
Mhm.
able to help, use that as a component of building bone back?
Yeah, this was actually one of our biggest issues out of the gate, is that we have gut health experts, so that part,
Mhm.
no problem. I'm an expert in hormone optimization and replacement, no problem. We look at all the other foundational pillars, and we can talk about sleep, and we can talk about stress mitigation and connection and spiritual health. But man, how do you tell somebody through Zoom how to work out? And
It's not
that was
easy.
a big challenge out of the gate. So here's what we did, which is initially I ran across a woman by the name of Rebecca Rothstein, and she created a company called Buff Bones. So
Oh,
she
yes, I
has,
saw that on your,
yeah.
yep.
So she has a story of having osteoporosis, really young, and doing well and reversing it early. And she is a Pilates instructor,
Hmm.
Pilates trained, and she created this Pilates based style of movement and exercise. And what I love about that is that it's a starting point that pretty much anybody can do safely.
Hmm. Hmm.
And so we utilize that, and we utilize that in several different areas within the program. For people that are ready for more, we have now instituted a one-on-one with a PhD in exercise physiology. And I don't know that Nick is on our website yet, but Nick Truby, like I said, PhD. So he'll do a
Hmm.
one-on-one with people, kind of figure out what their starting point is, watch
Hmm.
some movement, and then we plug them into some kind of they're custom but predetermined, right? So we have these little
Hmm.
paths, and we can kind of plug them in wherever, and then customize them as needed,
Hmm.
so that people can start doing more. For people that want to really lift heavy weights but need to know how to get there, that's how we
Right.
get them. And then we've hired, as I said, more coaches. So now we have coaches that are actually really well trained and have been doing this for years in the performance space. So we're
Hmm.
taking people that have been actually, training athletes, training high
Hmm.
performing individuals, putting them in this space around bone health to because they know how to talk about progressive overload and form, and
Hmm.
where does this bar go on my shoulders? Like, what do I do with like they can answer all that very, very easily
Hmm.
through a telehealth platform. And then ultimately, if somebody really needs one-on-one, just tell them that. We're like, look,
Hmm.
we have all these resources for you. However, I think for your safety, you should probably work with somebody who can lay their hands on you. And
Right.
sometimes that's
Hmm. Excellent. Um, where was I going with this? I'm just blown away by all this information. It's just amazing. I love the team that you've put together. Like I said, I love the program. Um, do you have people once they graduate and they just move on, or do you have like an ongoing connection with your patients?
yeah, we actually have this is a really good problem to have, but we have a problem where people don't, once they experience care the way that I feel like I want to be cared for and the way that I
Hmm.
treat my patients, they don't want to leave.
Hmm.
And so this is actually a problem from a growth perspective, and why we're continuing to add to the team is that my schedule is pretty saturated, but we don't want to stop here. And
Hmm.
so people generally, but I think our retention rate is somewhere around 90%. So they
Wow.
don't go away. Um, what we do though is we kind of figure out, okay, what kind of resources are you utilizing? What are
Hmm.
your needs? And then we can just come up with a plan to say, look, if you just like, you don't need any other resources than just meeting with me, then we can put a price on that. You need, these components, we can put a price on that.
Hmm.
I can do whatever I want because I'm the CEO. So I
Right.
can I can wheel and deal and just make it work. And ultimately my goals is just to keep people in the program, to keep taking care of them, and to, keep my team busy and continue to build.
Well, it's kind of like a champagne problem. It's a good one to have.
It's a
If
good one to
people
have.
love you that much and they're getting that much benefit, yeah, then why would they want to leave?
Yeah.
So it is a good problem to have. I'm really curious about, and this might be a question that's like way out of, left field, but do any of your trainers, do they teach people how to fall?
Great question. It does sound odd. I don't know. It's a good question though. I've not broached that with any of my team, and it's difficult to do, I would say, through how we do it. So that would be something where I would actually be concerned about how that would play out if you're teaching somebody how to fall through Zoom. It is a good skill set though, for sure.
It's an amazing skill set. I fall at least 3 times a week at the dojo. A variety of different falls.
Different. Yeah, that's good. Yeah, you're in the right setting now.
I am in the right setting, and I didn't just, again, come right out of the gate falling. It was definitely an educational process, and
Yeah.
it was done in a very safe way. But I think there's so much value to that, that I will never stop falling.
Yeah. No, that's great. I think we could do better there.
Yeah. As a matter of fact, I had a spectacular fall. It was New Year's Eve day. Walking out of the dojo, there was some black ice. I didn't know it. My arms were full. Oh, yes. My arms were full of stuff. And one minute I was walking out, and the next minute I was in the air and on the ground. And it was like, wow, all of my, my arms were full. So my water bottle, my keys, my sword, my katana, my notebook, even the pages flew out of my notebook. I hit that hard. And of course, the guys came running out because they saw me. And the first thing I said was, did you see my break fall? Because it was spectacular. And it was on cement. And I'm well over 60. So I was very proud of that.
Yeah. Good for you.
Yeah. Don't want to do it again, though.
No.
So how can people get a hold of you? All the your links and everything are in the show notes. It's going to be there forever. But I really like for my guests to be able to articulate how people can connect with you, how they can find you, get more information like the YouTube channel, anything that you have that you can promote. I would love to hear.
Yeah, so we'll have to make sure that you have the link for the book because that's new, and so we'll have to get you that.
Yeah,
So the
I need
book's a
that.
great way to read our approach. I really go into the depth on the research around hormones. I know there's so many questions about hormones, and supplements and nutrition and our approach to all these things. So that's in the book, and so it's a quick read. It's like 150 pages. So that'll be in there, and it's available on Amazon. And then the YouTube channel, like I mentioned, is really popular, and that's just Optimal Bone Health with Dr. Doug, I think. But if you look up Dr. Doug, you'll find it. And then the website has a lot of resources as well. So that's optimalbonehealth.com. And that has free resources on it. And then if you want to reach out to our team, all of the channels have a way for you to do that. But the easiest way would be through the website.
Okay, excellent. So before we wrap things up, do you have one final pearl of wisdom or information that you could share with the audience who might be thinking, oh, I see these commercials. I know I'm going to fall and I'm going to die. Of what steps they can take so they're not going to fall and they're not going to die and they can build better bones?
Yeah, I mean, step number one is find out. Early testing is really important, and this is a huge issue in the bone health space because the recommendations to get your first DEXA is at 65 if you're a woman, and 70 if you're a man. And that's way too late because the horse is so far out of the barn at that point if you have a problem. Now, for people that don't have a problem, it's fine. But how do you know? And you know by getting tested early. And DEXA, we didn't talk about, but DEXA is not a great study. It's not a perfect imaging study, but it will let you know what your current status is. So step number one is learn, get tested. And then step number two is be an advocate for yourself. There are so many, I shouldn't say so many, there are a few very particular issues that our traditional system, while good at some things and really good at some things, are terrible at. And those things are treating, reversing, and preventing osteoporosis, diabetes, dementia prevention, cardiovascular prevention, and cancer prevention. And if you notice, what I just listed there are the top 4 causes of death of adults in the United States. Right. And it's because these disease processes are diseases of decades. And our system is very short-sighted in that way. They're good at treating, in using drugs or surgery or whatever, but to teach somebody how to not succumb from a disease that takes decades to progress and occur, we don't have a way to do that in our system at all. And so that really takes a different approach. So you really have to reach out, be an advocate for yourself, look for those people, and I'm in a group of physicians that are creating this new space. This, if you're familiar with Peter Attia's work, Peter calls it the medicine 3.0 space. And I really think the way that we're going to build that is by continuing to support each other as physicians and bringing us all up together so that we can provide a network of care that is at this new level, which I think should be the expectation.
And your results and the patients actually sharing their experiences, I think is incredibly valuable as well.
Yeah, absolutely.
Well, thank you, Dr. Doug, for being here. Thank you so much. I really appreciate your time and sharing all of this wonderful information. And I really have to say, I'm very happy for you for stepping out of that surgical space. I know it was hard and I know it was very challenging, but look at all the good you're doing. And you're reaching people all over the world, not just the ones who come in through your ER. Yeah,
absolutely. You're so right about the world, and YouTube has been amazing for that. We have about 40% of our audience is international.
Oh, that's awesome. See, you couldn't have done that just with a scalpel and what was it? It was in one of your profiles, something I read, a scalpel and a prescription pad.
Yeah, that sounds about right.
Yeah. Okay. Well, thank you so much for being here. Appreciate it.
Thank you, Cheryl.
And everybody, thank you so much for listening. Oh, please do share this episode with everyone you know. Incredible information. And remember to be an advocate for yourself, educate yourself, and do check out Dr. Doug's website and his YouTube channel, a wealth of information there. And we all need to stay strong, healthy, and vibrant, and we can with the right help. And that is the way of the FemiNinja.